we will discuss leg swelling, the top 5 causes of it, how to diagnose, and how to treat it. Leg swelling occurs when fluid accumulates in the tissues of the leg. This fluid, which is plasma, leaks out of the capillaries and into the surrounding tissue. People may experience pain, discomfort, or redness of the skin, but the most common and noticeable sign is a visible increase in the size of the affected leg. The most common cause of leg swelling is chronic venous insufficiency, which means the leg vein valves become weak and damaged, leading to blood flowing backward, failing to return blood effectively to the heart, and causing fluid buildup. This condition usually occurs due to age, obesity, prolonged inactivity or sitting for extended periods, and pregnancy. Patients usually notice swelling in the lower legs and ankles and heaviness in the legs. It is commonly associated with varicose veins, and the skin can be irritated or itchy. Symptoms worsen when a person sits for prolonged periods or during the evening after a day of activity and in hot weather like summer days. The second most common cause of leg swelling is heart failure. When a person has heart failure, leg swelling is usually not the only symptom. Other common symptoms include shortness of breath when physically active or lying down, weakness, irregular or fast heartbeat, swelling of the abdomen, and difficulty concentrating. It most commonly affects older adults, typically those over 65 years of age. More commonly, patients are already aware they have heart failure when they notice leg swelling, which often appears as the disease progresses. Initial symptoms typically include shortness of breath and fatigue before noticeable leg swelling. Another cause is lymphedema, which occurs when the lymphatic system is impaired, leading to fluid retention in the tissues. Lymphedema can be congenital or caused by physical damage to the lymphatic system, such as infection or radiation. Even chronic venous insufficiency can cause lymphedema. Patients with lymphedema experience heaviness and persistent swelling in one or both legs, recurrent infections in the affected limb, skin hardening, and thickening due to fibrosis, and a restricted range of motion. For diagnosis, lymphoscintigraphy is used, involving radioactive tracers and a gamma camera to observe blockage and lymphatic flow. MRI and CT scans are also used, as well as ultrasound to identify if the cause is related to the lymphatic system or another source. Stemmer's sign is used to identify lymphedema. It means the inability to pinch the skin on the top of the toes, indicating thickened skin and underlying lymphedema. Also, pressing on the swollen area doesn't leave an indentation. This is called non-pitting edema. In this condition, pressing on the swollen area doesn't leave an indentation, pit, that persists for a few seconds to minutes. If it leaves an indentation, it is called pitting edema, which is usually not caused by lymphedema. For example, chronic venous insufficiency causes pitting edema. Another cause of leg swelling is deep vein thrombosis. It happens because a blood clot forms in a deep vein, typically in one leg, causing swelling, pain, and redness. Deep vein thrombosis is considered an emergency condition because it has a significant risk of pulmonary embolism, which means a blood clot formation in the lungs. It commonly occurs in people with prolonged immobility, such as during long flights or bed rest after surgery or illness. The use of birth control pills can also increase the risk, along with pregnancy, obesity, smoking, and some cancers. Pain can have a sudden or gradual onset, with swelling in one leg. Pain and tenderness are especially prominent when the person is standing or walking. The leg skin may be discolored, with redness, and the person may feel warmth in the affected leg. A D-dimer test is commonly used, and elevated levels may indicate the presence of an abnormal blood clot. Ultrasound is the primary test to assess deep vein thrombosis, along with venography. Kidney disease sometimes causes leg swelling. Conditions like nephrotic syndrome and chronic kidney disease more commonly cause fluid retention and swelling in the legs. Other common signs of kidney problems can include swelling around the eyes and foamy urine. Some common medications also cause leg swelling. For example, Blood pressure medications such as calcium channel blockers, amlodipine, nifedipine, verapamil can cause this. Sometimes, lisinopril and other angiotensin-converting enzyme inhibitors also cause leg swelling, as do nonsteroidal anti-inflammatory drugs, aspirin, naproxen, and ibuprofen, due to sodium retention. Now, let's discuss treatment. Leg elevation above heart level several times a day reduces fluid accumulation. Each session should last 15 to 30 minutes. Compression stockings improve venous return and reduce swelling. They should be worn throughout the day and removed at night. Exercise and physical activity, especially walking, promote circulation, and leg exercises can help strengthen muscles and improve blood flow. Weight management is crucial. Maintaining a healthy weight reduces pressure on the veins and improves circulation. Reduce salt intake to minimize fluid retention. Aim for less than 2,300 milligrams of sodium per day. Ideally, reduce it to 1,500 milligrams per day for better control. Avoid prolonged standing or sitting. Take regular breaks to move around if you have to stand or sit for long periods. Use a footrest or elevate your feet when sitting. In cases of heart failure, kidney disease, or liver disease, diuretics such as furosemide are used to help remove excess fluid from the body. Diasmin, hesperidin, or their combination are used as venotonic agents. Diasmin is usually taken at 500 mg and hesperidin at 50 mg with meals, twice a day. Horse chestnut extract is usually taken at 300 mg twice a day with meals. For lymphedema, manual lymphatic drainage, a specialized form of massage, and complete decongestive therapy, CDT, can be effective. Grapeseed extract, commonly used for its antioxidants, improves blood flow and reduces swelling, usually taken at 150 mg daily with meals. Traxarutin is also common. It reduces symptoms of chronic venous insufficiency, improves venous tone, and decreases capillary permeability, typically taken at 300 mg 3 times daily with meals. Generally, these supplements are considered safe and are usually taken for several weeks to several months. It's important to always address the underlying cause of leg swelling because symptomatic treatment is usually not sufficient for a long-term solution. In the case of deep vein thrombosis, anticoagulant therapy is important and crucial.